Meghalaya is already having a set of standard operating procedures to prevent the outbreak of avian flu in the state. The avian influenza, commonly known as bird flu, has created havoc in many states in the country. As a precautionary measure, the Meghalaya Animal Husbandry and Veterinary Department is likely to release a set of SOPs and guidelines to be followed to prevent the outbreak of bird flu in the state. The Meghalaya Animal Husbandry and Veterinary Department is also mulling to carry out mass culling of poultry if bird flu breaks out in the state. Meanwhile, the Government of India is keeping a close watch on the outbreak of the disease. The government has alerted the local authorities in the state where the bird flu disease broke out to raise surveillance of 12 epicenters where thousands of birds died in the last few days. The centre has further asked the states to set up containment measures. However, no human case relating to bird flu has been reported so far. The centre has further set up a control room in New Delhi to keep a watch on the situation. The states were also requested to keep a vigil on any unusual mortality amongst birds and take necessary measures. The Union Environment Ministry has termed the situation as serious. Avian influenza or bird flu has been detected in 6 states: Haryana, Madhya Pradesh, Himachal Pradesh, Rajasthan, Bihar and Kerala. Avian influenza or bird flu is a viral disease that occurs naturally among wild aquatic birds and can infect domestic poultry and other birds and animals. Bird flu is contagious, which can get transmitted to humans. Bird flu is considered to be more dangerous than the coronavirus. While the mortality rate of coronavirus at present is 3%, the mortality rate of bird flu is 60%. The mortality rate of patients with bird flu is 20 times higher than that of the corona. Symptoms begin to appear in a person within 2 to 8 days after he or she gets infected with bird flu. Fever, cough, runny nose, headache, swelling in the throat, muscle ache, stomach issues, difficulty in breathing, infection of the eye are some of the symptoms that emerge in a person after getting infected with bird flu.